From the childhood, we all have been taught that we need to brush our teeth twice a day to keep a good oral hygiene. However, very few people have actually told us that what kind of a toothpaste to use for your health. Yes, I'm talking about the toothpaste. Very few people pay attention to the toothpaste. What if I tell you that the toothpaste which you are using might be responsible for your thyroid health? It sounds shocking, but it is a fact. Let's talk about what kind of a toothpaste a person with the thyroid should use, and in fact everyone should use. Namaste, my name is Dr. Tanvi Mayur Patel. I'm an endocrinologist, hormone specialist doctor from Mumbai, India. Now before I begin this video, one important information. If you want to watch this video in Hindi language, then on the I button and below in the description box there is a link. If you click on that link, then this video will be played in Hindi language for you. अगर आप आज के इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. So let's continue our today's topic. See, most of the time the toothpaste which is used are all fluorinated toothpaste because that's what the majority of the companies manufacture. But this fluorinated toothpaste is a very harmful for your thyroid health. Yes. How it is harmful, that's what we will learn. But before we talk about how it is harmful, it is important for us to know that what is this fluorine and fluoride. See, if we go back to our school, in the chemistry subject, we all have been taught a periodic table. So this fluorine is actually a halogen compound, and the negatively charged ion of the fluorine is called as a fluoride. This fluoride is a very toxic product, and it is very harmful for our body. In fact, fluoride is actually a byproduct of many aluminium and a fertilizer and many other industrial waste products, and it is considered as a toxic product. The fluoride and a thyroid association is a very long association. It's more than a decade, it's a more than 100 years of the association. Let's go back to the past. In the year 1930, yes, nearly 100 years ago, fluorotyrosine was a compound, and this compound was used as a medication to treat a hyperthyroidism or a Graves' disease. This fluorotyrosine medication used to be manufactured by a German company called Bayer. And this fluorotyrosine, how it used to work? The moment you take the fluorotyrosine medicine, it will start destroying all the important enzymes which is required for the thyroid hormone production. And because of that, the entire thyroid production will get suppressed, and that's how it used to be treatment of a hyperthyroidism. But unfortunately, many patients, they had a complete destruction of the thyroid hormone production also, and that is the reason why this medication was taken out from the treatment. But unfortunately, what is taken out as a medication still continues to be used as a fertilizer and a chemical, and a fluoridated toothpaste is a rampantly available across the globe. Now, so that is what the history of a fluoride and the thyroid is. When you continuously use the fluoride containing toothpaste, it causes the slow accumulation inside your body. And this chronic, long-term, slow, progressive accumulation also damages your genes. Yes, see, understand, this fluoride does not get excreted or thrown out from your body. It keeps on collecting and collecting, and gradually it reaches to your genes, and also it affects your chromosome. And that is the reason why many of the times the thyroid problem are also considered genetic, because the genes are passed down from the parents to the children. And this fluoride compound is also considered as a neurotoxin, and in fact it is found that the children IQ is also affected by this fluoridated compound. Okay. Now let's understand how fluoride actually destroys and damages your thyroid gland. See, for thyroid gland, their main job is to produce T3 and a T4 hormone. And for the production of these hormones, there are series of the chemical reactions which happens. And in these chemical reactions, we need a good quality of an enzyme. These enzymes are very important. What fluoride does? The fluoride changes the protein of the enzyme, and because of that the enzymatic protein is changed. Now when the protein structure is changed, our body, our immune system thinks that this is an outside element, and our body and immune system turns to protect us. So they want to protect from this altered enzyme structure, and that's where your immune system starts making antibodies. They want to attack that enzyme, but in doing that, so it also attacks your thyroid gland, and it makes you vulnerable for many autoimmune thyroid problems like Hashimoto's disease, Graves' disease, thyroiditis, just to name a few. So all of these autoimmune problems crop up because of fluoride compound. The story does not end there. The fluoride affects the entire thyroid hormones working mechanism also. For thyroid gland to produce right amount of a hormone, it needs a right kind of a signal, and that signal comes from a pituitary gland which is located in your brain. This pituitary gland makes a hormone called TSH, that's a thyroid stimulating hormone. Fluoride affects the TSH production also. Second way it works is that for your thyroid gland to make a thyroid hormone, it needs an iodine. And when you have a fluoride in your body, it displaces this iodine, and that's the reason why your thyroid gland do not get a sufficient amount of iodine, and that also causes the compromised thyroid function. Thyroid gland, which makes two main important hormones, T4 and T3. The T4 hormone is the inactive and a T3 hormone is the active, which is going to function in your body. For this T4 hormone to get converted into T3, again it's an important step, and that is also compromised due to the fluoride content in your body. Another way it functions is that the whatever thyroid hormone is there in your body, it has to work at individual cell, and that does not happen because fluoride mimics to these thyroid receptors, and that's how the thyroid eventually does not reach to every part of your cell, and that makes you feel like an hypothyroid. So even if you have hypothyroid, you are taking the right medication, right dose, it's not working correctly because the root, that's a fluoride, is still lingering in your body. So what to do? What is the solution for that? The solution is very simple. You have to cut down on your fluoridated toothpaste. Having said that, only fluoride is not the responsible. So next time whenever you go and buy a toothpaste, make sure that you read ingredients. It should not contain fluoride. It should also not contain a chemical called triclosan, which is a very commonly used because it has antibacterial properties. Third compound is a SLS, sodium lauryl sulfate. Again, this is a endocrine disruptors. All the artificial preservatives and sweeteners, they also damage your thyroid function. So make sure that such chemically loaded toothpaste you do not buy for yourself or for your family member. So what kind of toothpaste you can buy? you can buy for Ayurvedic alternatives, which is going to be more helpful not only for your oral health but also for your hormonal health. Alright. I hope after watching this video, you got some good useful information. If yes, please click on the like button. If you are new to my channel, please don't forget to subscribe so that you get more and more health related, most important hormone related information. If you have any of your personal question whose answer you are seeking for, write that in the comment box below. I try to read and answer them as early as I can. Thank you for joining me till now. We will meet again with some new good useful information. Till then, take care of yourself. Namaste.